Okay, let's
please start.
Start.
Yes.
Sir, we start our session. We can start, no?
Yes.
And
start.
yeah, problem will be solved. So many doctor. Tomorrow my chamber is in Esplanade. There are so many doctors will come, and so no problem, sir.
Okay.
From chamber
Fantastic.
I must
Fantastic.
phone you. Oh, okay. Now today's session is on. Previously, we have discussed how we can prevent, how we can control, how we can cure the COVID-19 patient. There is one option. There was one option. Today there is other option. As because so many people, they are very much interested for prevention. But regarding this prevention, I must tell, person is suffering from anxiety neurosis before the infection by the COVID-19 coronavirus. So they are very much anxious regarding this. Why this anxiety? Why? Why this anxiety? Today's class is for this. Previously, we have uttered one thing, that there is another infection, that is psychological COVID. As the number of cases of COVID-19 has been increased like flood, so many persons are in psychological COVID. Different therapeutic system has discussed regarding COVID prevention, treatment with COVID. But there was not a single word regarding this psychological infection, psychological COVID infection. And if it is not corrected, so only treating COVID patient, only prevention with different drugs, maybe it Ayurveda or allopathy or other homeopathy, other than real homeopathy. There is discussed one thing, that is how we can prevent. What prevention? Only COVID. But the land where the COVID, তুমি যাও নিয়ে আসতে যাও, তুমি মোড়ে থাকবে, ফোন করে দেবো আমি, তুমি ফোন করে নিও। তো for growing something, for propagating something, first and foremost is needed the land, the environment is needed. If you do not destroy the environment, no permanent solution is possible. Only permanent solution is possible, if you root out from the mind of each and every individual. And for this purpose, we have to treat a man with the help of real homeopathy, considering which environment is suitable, for COVID infection, either practical or psychological. So, today's discussion is considering that very environment, psychological environment, mental environment. If a person want to free from that very COVID, first and foremost condition is the person should be strong regarding his mental condition, mental state, psychological state. When a person is suffering from anxiety neurosis regarding any infection, any negative situation, it may be COVID or not, that very person is very suitable, belongs to very suitable environment for any infection, including COVID-19. Again, I am telling this very important thing. What it is, everybody has clear idea regarding this natural phenomena. To grow, to propagate anything, suitable environment is needed. And that environment we belongs to. Someone is telling, no COVID will attack me. Someone is telling, nothing sure. We cannot tell what is going on the next day. So we have to take medicine to save ourselves. We have to take medicine. And medicine they are taken for COVID. This medicine, it may be turmeric powder, it may be arsenical 30, it may be camphor 200, it may be. It will, it may protect. But that very psychological state, that very mental state, it cannot be rooted out without considering the philosophy of early life, as because every baby after birth express their philosophy. Immediately after birth, this journey started. This journey starts. And if we consider this very point of those days, if it is possible, otherwise another way is there to collect of the early life, information of early life. There is a process. But to acquire this knowledge regarding philosophy of early life of a more than 90 years old persons, there is a technique. But the physician should have to agree with this hard labor. But way is there. If we can know the philosophy of early life, with that very information, we can overcome that very anxious mental state, or in the other word, anxiety neurosis. Not for COVID. So many persons are thinking negative regarding different things. It may be COVID or not COVID. So say this, everybody is not infected with this COVID or infected with other infection. I think the dengue, it is also started. All these things. Everybody is not suffering from diabetes. Everybody is not suffering from hypertension. What I am going to tell, parents have diabetes, hypertension, all like this. But they have 3 baby. Only one baby is having hypertension. Another baby is having diabetes mellitus. But third one is free from all these things. So, it does not mean as parents are having all these things, so everybody is to suffer from all these things. It is we have to consider the vitality, the immune system. For all the disease state may be infectious, may not be infectious. From everything, there is a suitable environment created from the genetic infrastructure by which the individual's mental state is controlled. And this mental state, if it is controlled, the individual can overcome all the adverse situation. But why we have told only carbo-based fast? I have discussed it previously, but I think it should be again discussed. What is carbo-based? What for the carbo-based is? Actually, carbo-based is anti-post-trauma syndrome. Means carbo-based is needed for those who are traumatized from few generations. What does it mean, this trauma? This trauma may be due to any addiction. Suppose my grandfather has an addiction with tobacco. My great grandfather has an addiction with coffee. My grandmother has addiction with snuff. Someone is having addiction of tobacco chewing. That thing also creates trauma. Again, my great grandfather got an idea that if the dog lick his leg on the ulcer part, it will be cleared. It will be okay. As because that person has seen that when any infection, any trauma, any ulcer is there, the dog itself treats it only by licking with the tongue. With this idea, that person took the help of dog. See, so fine idea. But this thing also create trauma and also create post-rabies syndrome. So different type of trauma. It may be marital trauma also. My mother had to suffer a lot with by her mother-in-law. And that time I was in her womb. That thing also create trauma. I have lost my very nice job of multinational company. Suddenly, that company is stopped. That create also trauma. That trauma can affect. There is effect with this very trauma in my child. So, according to Master Samuel Hahnemann, according to Master James Tyler Keynes, they are having this idea. We are carrying so many genes, and those very genes are inherited from our ancestors, and that all those genes must create some of trauma, and that is why, according to my consideration, my study, no person in the universe is free from trauma. It may be direct, it may be indirect, but indirect is maximum 99.99%. We are having this, and we acquired it from ancestors through gene. And that is why so many persons is responding with this carbowave. Another thing, when I was in my mother's womb, that time mother was treated with different medicine. Before a pregnancy of my mother, my father had to take so many medicine for his sleeplessness, for his anxiety neurosis, for his either he was addicted with alcohol, all these things. It was, I must be affected, all these things. It is also called trauma. And after birth, I have to take so many medicine I was given. So many medicine for just after birth, there is a late weeping. My eyes were not properly open. I had on that very time the attack of cold. That time I was not clear bowel movement. I wept all night. So many causes, for so many causes, so many medicines I was given. That also create trauma. So you think, who is free from trauma? Whose parents are not taking any medicine, are not taking any I call like this addiction, free from addiction. So you can find it out all over the universe, all over the world. There is a trauma, full of trauma. That is why I have mentioned. And that trauma, the only medicine carboways can neutralize this very situation. And by this, the immunity will be sufficient. The vital reaction will be sufficient. By neutralizing all these traumatic situation, traumatic condition, and by this way, when we will be treated with this, firstly, then the first idea, the foremost idea, that all these adverse, everybody will be free from all these adverse situations, which we have gained from ancestors, which I have uh, gained it from medicines the physicians has given for removing our suffering from free from suffering. So that is the idea. So it is not unscientific, and it is the correct explanation according to different teachers. The masters, they are very much young person. They came and given this very idea. So this is the idea regarding carbohydrates. But you can't tell regarding other medicine. This is hydroxychloroquine only for this. And this is the correct medicine. And this is arsenic herb. This medicine is like this. But why? No answer. No answer for this. One thing I previously mentioned, the treatment is going on with different therapeutic system only for result of the disease, mind it. And so many times we ourselves, our family, the ancestors have treated like this only for result of the disease. And that treatment due to result of the disease created trauma. Also creating trauma till today. That very arsenic, that very hydroxychloroquine, or other antibiotics. Every medicine, maybe it Ayurveda also, as because all the medicines are using not due to COVID for any problem. We are taking medicines only for result of the disease. And that very procedure is creating trauma inside ourselves. It is for not for anyone. It is for everybody. When we are taking medicine for fever, when we are taking medicine for cold cough, when we are medicine for migraine, when we are taking medicine for anxiety, neurosis, sleeplessness, constipation, loose motion, for any type of result of the disease, we are taking medicine. You see, everybody is taking. Even doctor, the person, the authentic person who is giving medicine, who is treating himself, he or she also taking medicine for the result of the disease. And this very thing creating immunodeficiency. Mind it. And note this very important point, immunodeficiency. WHO, different experts have supported this very idea, what it is. Everybody should upgrade the immunity. Everybody should upgrade the immunity. But giving medicine for what? The result of the disease, again creating immunodeficiency. What it is? See, it is not a matter of love. They are telling, upgrade your immune system, but they are giving medicine which is creating immunodeficiency. Ask them, sir, what is this for? This medicine for? And this medicine for this. But why? No answer. They will again ask you, why you are asking? Are you a physician? I am a physician. If you know more than me, so go. Go. Otherwise, anywhere you go, you leave me. But fact is this, the medicine we are taking for upgradation of immune system, but that very medicine, other than carbophage, is used for treating, not for the disease, but for result of the disease, which is creating immunodeficiency. Then the helpless person will go where? Where they will go? They are feeling helpless. When the person go to the physician and begging help for him or her, and physician will give medicine which is creating immunodeficiency. Please note this point. For upgradation of immune system, turmeric powder. This is also for the result of the disease. And then you must tell, by taking this turmeric powder, all this medicine, patient is feeling better. But this thing will tell in future what is right, what is wrong. As because James Taylor Keynes has told very nicely, prescribing for the result of disease. When the medicine is given for the result of the disease, means other than 6 true disease, hypertension, diabetes, pain, joint pain, acidity, cold cough, fever, everything, constipation, diarrhea, everything, cyst, tumor, warts, piles, fistula, thousands of diseases are there, lakhs of diseases are there, and treating is done according all these things, not for 6 true diseases. That is why Kent has told, prescribing for the result of the disease causes changes in the result of disease. Everything will be okay. Everything will be okay. What is going for the prevention of COVID, it also done his duty. Turmeric powder, it also done. All these things. Kent is mentioned very nicely. If you medicine all this result of the disease, everything will be okay. Then Kent has told what? After that, this medicine is not for true diseases. That is for sickness. That is why that very 6 true diseases become complicated. So you consider this point. What you are seeing, everything is okay. The saint is giving a beautiful water from such and such. That very Maulavi is giving water from Damdama. Someone is giving arsenic. Someone is giving camphor. Someone is giving hydrochloroquine. Someone is giving all these things, like all these things. So everything has mentioned Dr. James Taylor Keynes. It will be okay. No. At present, everything will be okay. What medicine you can take? No problem. Everything will be okay. So everybody is demanding, yes, my medicine is correct. My medicine is correct. My medicine is correct. But you have to consider that very point. This medicine is for a result of the disease or for true diseases. Very simple word. Again, I am telling, is this medicine? It may be anything. Is this for result of the disease or is this for true disease? As it is for COVID-19, so it is result of the disease. So it will be okay now, no problem. Once one of my brother has asked, sir, everybody is demanding, he is writing, right? But now I am asking you, you please tell what is written in the book. Treatment, how treatment should be like this. Is it due to true disease or result of the disease? If my medicine is also for result of the disease, that medicine also clear. Immunodeficiency. And in future, that individual has to suffer a lot. Wait for those days. So no question of everybody is demanding, he is right. No question of that. It is a question of science. It is not question of therapeutic system. It is a question of science. All of you have to consider this very point. Your medicine for what? It is for result of the disease or it is for the true disease. So this time all of you will show the fruit of the treatment, but in future the coming days will tell what has going on with that very palliative or suppressive or the instant working like electricity, the effect of those very medicine. And you see one thing, how many infection you will treat? Now there is a COVID. 10,000, more than 10,000 virus is waiting for. So, then, according to my knowledge, we have to make a PPE not for COVID, but for all infectious and also for non-infectious problem. So, find out those way, find out the exact way for how all the infection you can fight against. You can fight against all these infection, non-infection disease. And what is the way? Now, the correct immunity, the exact immunity. Immunity should be upgraded. The vital reaction should be proper. That is in in this one word, you have to remove the immunodeficiency with proper treatment. What I have told? The physician, we are the physician, the only duty is to remove immunodeficiency. That is upgradation of immune system. And in the language of homeopathy, the vital reaction should be proper. The vital force must be healthy. Then all the problem will be solved. Maybe corona, or maybe COVID-19, maybe 21, maybe 1900, maybe 19,000. The coming days they may come. And dengue already started. So all this infection is started only by our immunodeficiency, which is created by unscientific way of treatment, unscientific administration of medicine. You please understand this very point. Then COVID will go. No problem. Sir is telling very good proposal regarding COVID. But I think COVID is not a problem. No, COVID is not a problem. There are so many problems more than COVID, as because we are taking medicine day by day unscientifically. We are, each and everybody of us are taking medicine day by day unscientifically. Why? Now, we are taking medicine only for the problem. We are not taking medicine. Why this problem started? Very simple language. I think so. So there is no complicated explanation. I think so. So do it. Do it, physician. You say, you physician, and do it for your patient. Then COVID will go by without any proper treatment. Only treatment is for upgradation of immune system. Only upgradation of immune system. And that is possible only with those medicine which is prescribed for the result, not for the result of the disease, but for the true disease. So if we want to save this paradise, then this very thing should be maintained. And all this information is, I am not telling, I am just copying. All these things is uttered by the masters almost 300 years ago. But there was no proper utilization. So that is the suitable environment what COVID-19 has got. If the environment is not so suitable for this infection, COVID must not propagate like this way. The number of infection is increasing. What it means? So many persons are having under immunodeficiency. They are under immunodeficiency. What should we do? We must tell that we have to remove the immunodeficiency. That means immune system must upgraded. But medicine will be considering that very point. It should not for the result of the disease. It should be for the true disease. And what is the role of real homeopathy regarding this? As because real homeopathy has few certain principles. First, the most important is philosophy of early life. Almost everybody has received this 14 pages information regarding philosophy of early life. And all 8 medicines philosophy is mentioned there. But sorry to say, only reading this, only hearing this, nobody can practice, as because all this thing is following strictly the principles of real homeopathy. Besides this real homeopathy, what is besides this philosophy of early life, there is so more information besides all these things. But the most important thing is the philosophy of early life. Different 6 drugs, 8 drugs had different philosophical view. First, I mention an example with which all of you will try to understand this difficult portion. A girl not married of 30 years, girl of 30 years or 32 like this. She loves very much for traveling. From when? Since her childhood. But one thing is very much important. That baby the baby want somebody will take her for wandering. But she was not agreed to for wandering with lots of person. He wanted this only with believable person, his father, his elder brother. She can believe only these very 2 male persons. Otherwise, no male person she can believe. From that very childhood, she never go out of house, out of home with unknown person. Or better to say, beside her father and her brother, she never went out for wandering. What it mean? Mean is this: she believed only selected person. Who are they? Her father and her brother. What it mean? Mean is this: that very baby was very suspicious. She can't believe everybody. She only believed the known person, her father and her elder brother. You see, what? This is the philosophical idea. So little baby want to wander, and she is very much fond of wandering, but only with father and brother, not with other person. This is the philosophy of early life. But now she is, suppose, 30 years of age. Now also, she, in spite of very much happiest subject, is wandering, but she never wander beyond the believable friend circle. Those who are believable friend, only with them she is agree to go out for wandering. So during her infancy, she was suspicious. Now she is 30 years. Now also she is suspicious. what it is. This is, this is pathophilosophical prescription. This is called as because this very philosophical idea, what was in his earlier days, and also having this very suspicious idea, and now also at the age of 30, according to her, she is this type of fellow. She can't believe easily anybody. She can't believe. So many persons, so many baby in the universe, in the world, so many baby following this very philosophical idea, the suspicion. And all those of suspicion, they must be introvert. And it is seen from my, I have seen from my study that they are family oriented, means family centered life, means they always very much careful, very much responsible for the family, and also each and every member of the family. And this is remain unchanged for during these 30 years. This is called philosophy. Previously it was philosophy of early life, and now this is the philosophy of this age. And this is, the medicine is to the Occidentalists, the pathophysical philosophical prescription of the individual. Like this, each and everybody is having different idea regarding life situation. And this idea regarding life situation is called philosophy of life. And it is from the beginning. It is from the early life. It was observed immediately after birth. Again, another point. Baby is very much angry. The mother understood this 30 minutes after giving birth of her child. Mind it, only after 30 minutes of giving birth, the mother understood that her baby is very much angry by nature. After 10. So you please mind, you please see, it is enjoyable. It is not for read. The baby's age is only 30 minutes. But mother understood that very moment that baby she belongs to is having very anger. The baby is angry by nature. How? After giving birth, after becoming fresh, she came to her bed and saw the baby is weeping a lot. Someone from other bed told her, hey, please give her breast milk. I think your baby is hungry. And when the mother is ready for that, the baby refuse it. Just refuse it. The baby wanted to tell, why you are so late? No, I will not take your milk. only at the age of 30 minutes. So this is called philosophy of early life. So everybody has certain type of philosophy. And with this very idea, the very important idea, nobody, no therapeutic system has given importance the philosophy of early life, except myself. Yes, one thing also I must mention. Master Henneman, Samuel Henneman, Master James Tyler Keynes also has not given any importance to this very, the most valuable information, the philosophy of early life. Only I myself in the world first given importance to the philosophy of early life. And I have written all these things. I have verified my idea for many times. Verification, re-verification, re-verification. After that, I am here today, Dr. Shymol Kumar. Confirm my idea. Only this very idea we can treat each and every individual, not considering any symptom of the patient. No symptom is needed for the treatment following the real homeopathy. Go back procedure of real homeopathic therapeutic system. No symptom is needed. No desire aversion is needed. No pathological result is needed. Pathological report is needed, but not needed for the treatment. We have the need of this all pathological report, what for we are giving medicine and what we are treating, and by our treatment with real homeopathy, what problem has been solved. Only for this purpose, we are needed the pathological report. But mind it, pathological report is not needed for the treatment. No rubrics is needed for the treatment. No desire aversion. No complete symptom is needed. Only philosophy of early life is needed. So this is a different entity. And this is very much interesting. I must enjoy my invention. I must enjoy how beautiful application, how shortly the suffering is relieved, is being relieved, how shortly the suffering person, the suffering person who is crying previously now is laughing. So it gives me pleasure very much. I enjoy my invention. If everybody is ready to give hard labor for this 14 page, but see, for this 14 page, you have to read 1400 pages written by me to make it understand clearly. This very 14 page you have to read. 1400 pages written by me as a literature of go back procedure of real homeopathic therapeutic system. So with this, I want to tell the world, the physician of different therapeutic system, if you want the welfare of the humanity, welfare of the human civilization, welfare of the human race, you must have to read a lot, because this is This is written in the book, but this is from the knowledge of the book, not utilized without your own understanding. You have to grow your analytical idea. First, you have to grow the analytical idea regarding all these things. পেন ড্রাইভের কাজ কখন হয়ে গেছে? তুমি পাগল আছো? এই তো পেন ড্রাইভ করে দিচ্ছি। হবে না, হবে না, হবে না। তুমি এখন যাও, এখন যাও। তুমি কালকে শোনো, রাতে ফোন করো আমাকে। আমি ফোন করলে ধরো না, তুমি করো। বাড়ি গিয়ে 10টার পরে করো। So now my message is to for the therapeutic world. Really, if you want the welfare of the human race, your idea should have to change, must have to change, as because the treatment for the result of the disease, treatment of the suffering, considering the symptom of the suffering, treatment regarding the suffering, considering pathological report, is harmful. Is very much harmful. You please consider the point. I am very much grateful to James Taylor Kane for given this very divine idea. What is the procedure should be the treatment. No medicine should be used considering the symptom of the suffering, considering the rubrics for the suffering, considering the pathological report regarding suffering. So we can proceed with my 8 medicines for COVID or non-COVID or psychological COVID, I must tell. And see, I have given one idea regarding Tuja. The one idea, Tuja, Medo, Hydrophobium, they are in same category, but difference is there. What it is? 3 of them are family oriented. 3 of them, the ambition of 3 of them is the welfare of the family and family member. The same idea regarding this. So I am telling these 3 medicines are family oriented. Means these 3 are thinking only for their family and for the family member. I think this is clear. But they are different in another condition. What it is? Hydrophobium, the medicine, very angry fellow, since birth till today, think the individual is of 100 years of age. So throughout the life, the anger is remain unchanged in case of hydrophobium individual who is family centered. But on the other hand, Thuja and Midorinam, these 2 medicine, very cool-minded during their infancy, even during their childhood. But after that, their anger must increase day by day. But in case of hydrophobium, the anger remained unchanged what it was in the early life, and it is in now.